So who are we? So we are a small board of 7. We have community members who are non-nurses and nurses on our board. ARNET, we've been a charity, you heard it on here, since actually 1985. We were established by the Alberta Association of Registered Nurses, a charity that would be there to provide educational funding for registered nurses to be able to advance their education. Likely at some point in your lifetime, you're going to be touched by the care of a nurse. In this province, we have over 40,000 registered nurses in the province of Alberta. 40,000. Out of that, there's about 800 that are nurse practitioners. Again, they're RNs who take advanced education. You help one nurse with some advanced education, and they take care of how many hundreds of patients. And then you think about the career of a nurse and how many thousands of patients one nurse can take care of in the career. So that investment in the education and continuing education of nurses as technology and healthcare changes in an incredibly rapid pace is essential. In 2022, we helped over 1,300 nurses in total with funding support. We have different programs we offer. We offer grant funding for continuing education. Over 1,200 nurses and RNs and NPs received that funding. We had 27 scholarship recipients. In our case, we have named scholarships. So people, most often it's related to the death of a loved one who was a nurse. They want to recognize this individual. They want to establish a scholarship at ARNET to have a legacy for them, and it's a wonderful memorial donation. And then every year you get an opportunity to meet this amazing scholar that your community, your family funded. Last year we also funded 7 nursing research projects, and so we're going to talk about the research we're funding today. We're going to say to you as we say that, because we're a charity, that the work doesn't continue without donors and partners continuing to support us. So we have seed funding. It's not going to last forever. In order to continue that work, we need organizations to step up and partner with us and help us. We need individual donors to come on board. So what did we fund last year? We funded projects on youth mental health. You're going to hear about one today on bullying. We funded a project on pressure injury prevention with one of the strategic clinical networks through Alberta Health Services through our work there with Tracy Wazalek. We funded a project with the Calgary Health Foundation on colorectal cancer prevention at the Rockview Hospital. A nurse who's working directly with a scientist in the Strategic Clinical Network, the Cancer Strategic Clinical Network, learning research, working with her colleagues, and every day, what is she doing when she's interviewing patients? She's having a direct and immediate impact on their experience in the hospital. So that's the beautiful thing, I call it, about nursing research. It's not happening in a lab where it might never see a patient. It's happening on the units as we're speaking with our patients and changing care right at that time. So she's changing care just by talking to people about how this happened. It has a direct and immediate impact on care. ARNET fills a gap. You know what we do? We help keep nurses in nursing. And they will say to us, thank you.